thanks to the development in the field of the psychology of dying and also thanks to the efforts taken by various death professionals, we have lot of developments in this field of psychology of dying, and one of that is development of dying trajectories. Now, all of you know that trajectory is a word taken from physics which indicates the path of motion of a moving object. Now, in dying trajectories, which was suggested by Glasser and Strout in 1960s in their pioneering work on the dying people, they have suggested using of dying trajectories. Now, these dying trajectories are not only useful for the physician, they are also useful to educate the dying patient and the family of the dying patient. There are three types of dying trajectories which you can see in the figure. So, in this figure you can see that the first dying trajectory which indicates people dying without any warning, that is sudden death, in this top line which is straight in, and this graph indicates that there is sudden death. Coming to the second type of dying trajectory, you have this blue line which is going downwards, which indicates that it is that the patient is suffering from a chronic disease and there is slow decline till the point of death. And the third dying trajectory, which is an orange line wavy in shape, you can see that this represents patients suffering from chronic illness. So, this represents patients suffering from chronic illness. Going to the examples of dying trajectories, the example of cancer trajectory. In this you have the functioning level of the patient and also time. You can see that initially the functioning level of the patient is high, and as the disease cancer progresses, there is a sudden decline in the functioning level which results in death. Now, going to another example of the dying trajectory, in the next slide you can see organ system failure trajectory. Here in this case, the patients suffering from heart and lung failure come under this category. And here, as you can clearly see in the graph, initially the functioning level of the person is high, but sudden decline, that is the time when these people are probably admitted in the hospital, and because of medical intervention they become normal, and once again they recoup and they reach a high functioning level. And this stays on say for some couple of months or for some people even years, and till a point when again they have another, say for example a heart attack. So, then again their functioning level comes low, and probably at this time they are admitted in a hospital. So, like this it can go on for 3 or 4 times, and a point comes when even the family members will think that okay, even this time this person is going to be admitted in the hospital and will return back normal, but suddenly and unpredictably the person might never come back, and then you can see that there is sudden decline again in the functioning which results eventually in death. Now, going to the third example of dying trajectory, which is dementia trajectory. Here you can see that initially the functioning level is high, but as time progresses there is a gradual decline till the point of death. So, all of us know that terminal illnesses such as dementia do not get revived even after medical intervention. So, there is a gradual decline, as you can see on the graph here, till a point of death. So, different dying trajectories help not only the physicians to plan for the treatment of the terminally ill person, they will also help discussing the problem with the patient. So, the patient can understand how his course of prognosis of the disease will take place, and the patient can get an idea clearly regarding how his near future might be. Not only that, these dying trajectories also help the family members to understand how the patient's progress will be. So, death is something that is unpredictable, but having these dying trajectories give them a solid kind of understanding regarding what will happen to their loved ones till the point of death. So, these dying trajectories also help the physicians and other healthcare professionals involved with the management and care of the dying person to determine the kind of treatment procedures. For example, whether to treat the person in an ICU unit or to keep the person in a hospice facility or to send the patient home and periodically ask the patient to come and visit. So, these dying trajectories determine many factors associated with the dying process, and over the years they have been very useful in many ways. Now, let us see what are the stages in reactions to dying. There are so many theories that are put forward by the death professionals, but one of the theories stands, that is the theory put forward by Elizabeth Ross. Now, she did a pioneering work and very detailed investigative work on terminally ill cancer patients, and her subjects are over 200. And she observed them, she conducted interviews with them, and she observed them all through the stages of cancer till the point of death. And she has shared her research findings in the book On Death and Dying. So, this famous book has been very influential in helping us understand the process of dying, and she has given the various stages in reaction to dying. So, in the diagram you can clearly see the 5 stages that she proposes. The first stage, she says, starts with denial, that is shock, and in this stage the person feels like saying it is not me. They do not accept that they are really afflicted with that terminally ill disease. In the stage of denial, usually these patients start feeling that whatever test results have come, that they are wrong, and they think that this cannot be happening to me. And also they do not like to talk with others about their condition. So, there is a decline in their level of functioning, as you can see in this diagrammatic representation, and after an initial stage of denial, slowly they start understanding that yes, they have to start accepting it, and they go through the path of guilt, internal conflict and loneliness, and finally have a burst of anger. So, they start responding in an emotional way, and some of the patients show anger towards themselves. For example, if they are diagnosed with cancer and that is as a result of their smoking behavior, then they might show anger feelings on themselves. And some patients feel angry towards the social system. It is the social system that has resulted in this particular kind of illness. So, they get angry towards the social system. Some others get angry towards the family members. Probably they might feel angry towards their parents. Had their parents brought them up in a healthier way, probably they would not be ending up like this today. So, some other patients also show their anger towards the health workers. So, like this they spend some time in anger emotional state where they blame themselves, their loved ones and also everyone else for their illness. After the stage of anger, as you can clearly see in this diagram, they go to the next stage, that is the stage of bargaining, when it occurs when patient accepts death but wants more time to live. So, some of these patients start thinking that it is okay to die, but I want to live till my grandchild is born, or let me live till my child graduates, or till my daughter is married. So, it is a state of bargaining, and many of them also start bargaining with God and pleading Him to give them more time so that they will finish off the unfinished businesses at hand, and then they will be ready to die. After experiencing this stage, they go on to the next stage, that is the depression stage. In this depression stage, it is a very low level, as you can clearly see here, and in this stage of depression, they start feeling very sad, they become moody, and it is also a time when their disease also will be progressing at a higher rates, because when patients are in a stressful and depressed mood, the physiological functioning also gets affected. But this depression sets in to almost all the patients dying with terminal disease, and it sets in at the point when they start finally realizing, yes, they have to die, they are going to die, and they have to leave all their loved ones. So, the healthcare professionals who are working with these people have to reassure the patients at this point of time, saying that yes, an amount of depression is common and that they can come out of the depression. So, after experiencing depression, they also go to the next stage, and that is the stage of acceptance. As you can see again in this graph, the stage of acceptance, again there is a rise, and they move towards positive responses in acceptance stage, and this is usually the final stage. And in this acceptance stage, the person gains back his emotional composure, and the person will start analyzing his situation cognitively, logically, and intellectually. And they also make preparations for leaving. They try even to console their loved ones regarding their impending death. They also try to help others in all possible ways, because these are the last few remaining days, and they try to make most out of it. So, these patients, when they come to the final state of acceptance, it also means that they are approaching death fast. So, Ross theory has been very influential. All these 5 stages of reactions to grief has been highly influential and highly applicable. But however, there are some criticisms. Her theories are not universal, because it is not that everyone goes through all these stages. There might be some people who directly accept their death and they do not go through all the other stages. And these also do not progress in the order she has mentioned. Some of the patients might have 2 or 3 stages together, and again reoccurring of an earlier stage. So, it does not actually progress in the manner she has suggested. And another criticism regarding her theory is that this theory is not applicable for a person who does not know when they are going to die. So, it is not universal. And another major criticism of Ross theory is that she did not include anxiety, especially that dealing with pain. Although she worked with cancer patients and lot of pain is involved in cancer, she somehow failed to mention anxiety, especially regarding to pain. However, in spite of all these criticisms, today Ross theory is considered as one of the best, and she is the first health professional who is credited with bringing the phenomena of death into the limelight. Apart from Elizabeth Ross theories, there are other theories also that are put forward, like that of Course theory, who speaks about coping with death involves doing certain specific tasks. And another influential theory is GREER's theory, and he also suggests 4 stages. According to him, it begins with denial, then the second stage is fighting spirit, when the person will try to put on a fighting spirit and they try to actively cope with the grief that comes after listening to the news of death. And the third phase is stoic acceptance, and the fourth is hopelessness, followed by anxiety. So, apart from these theories, we have more work that is done in understanding the dying process. For example, what kind of influence that social relationships have with dying. So, now we will see some of the social relationships, like for example, the loss of a parent. What impact does it have? Now, many of us predict that our parents will die before us. Even then, there is lot of anxiety and lot of grief that is associated with the loss of a parent. And this grief intensifies if the children are younger, because they are highly dependent on their parents, and it is the parents that are taking care of them, and they are the ones who truly love them. So, loss of a parent is really anxiety. So, loss of a parent is very depressing. So, the people who lose a parent undergo lot of grief, and they also try to fill in the generational gap. For example, earlier it was their parents who were serving as elderly members for the family. It is the parents who give all kinds of advices to the whole family. Now, because of the death of the parent, these people being next in the generational line, they have to take up those responsibilities. Next, let us see what is the impact of loss of a spouse. Now, this loss of a spouse is highest stress inducing, and when the person loses the spouse, there is lot of emotional gap in their life. And it has been found that men, when they lose their wives, they are worse at coping compared to women. And many men get depressed, and also eventually they also die quicker when compared to women. There might be a reason for this, because women are being more expressive, and women who let go their grief, they also get more kind of social support. So, if the spouse, widower spouse, tries to remarry, probably there will be less of an impact, but those who try to remain for long periods of time, and those widowers who do not try to interact with others, and they are supposed to be dying even quicker. Coming to the next loss, loss of a child. Now, this loss of a child is very traumatizing, because parents never expect to see any of their children die before them. And also, this loss of a child will usually because of a terminal illness, or because of sudden accidents, or because of suicides. In all these 3 cases, it is highly traumatizing to the parent, and they take a long time to recoup. Coming to loss of a sibling. Now, loss of a sibling also gives us a signal that yes, since our sibling has expired, death is nearer to us. When we lose a parent, we might still think death is far away from us, but when a sibling dies, or when a close friend who is of comparable age dies, then death comes closer to us. So, apart from trying to cope with the loss of the sibling, one has to deal with one's own approaching death. So, loss of a sibling is equally traumatizing. Loss of a sibling, the effect of this varies from age group to age group. For example, if a person lost his or her sibling in ripe old age, then the impact will not be so much, because this person might have had his own family and probably was not really associating with the other sibling. If this loss of the sibling is there during childhood, then it might be that the parents are spending a lot of time with the sick child. And mostly during childhood, the loss will be because of terminal illness. And during this terminal illness, there is long phase of suffering, and all throughout this period, this person might be really missing quality time with the parents, and the parents might be spending more time with the sick child. So, in that way there is loss. And apart from that, when the parents, if they do not discuss about the condition of the sick sibling, then this person also will not be able to understand being a child, and the trauma will be much intense. If parents spend time equally with other children apart from their sick child, then coping with death of this particular child will be better for the remaining alive children. So, not only these particular relationships, even there is an impact when a pet dies, for example, and how people grieve or bereave for the dead pet also varies according to the age group. Now, if it is for a very young child, the young child might be really missing the pet, the child might cry for the pet, and since the young child still does not understand what is death, now there will be lot of confusion. But coming to older children, they will miss the pet, and they will also show signs of depression and anxiety. They might also throw temper tantrums. Coming to adolescents and coping with the loss of a pet, adolescents, they to some extent understand that death is fatality, and that the dead pet, there is no chance for the dead pet to return. So, they might be looking at adopting or taking care of other pets. And coming to research evidence regarding the kind of impact that social relationships will have on dying, there are lots of studies, especially in the past 50 years. And these results of these research studies consistently indicated that there is lot of relationship between the kind of social support one has and the dying process. It has shown that people with low social support and people with less strong social relationships, they are the ones who have higher mortality rates. Clinical data has also shown that when there is kind of physical contact with other people, then the mortality rates are reduced. That is, this physical contact serves like a stress buffering mechanism, and so their life is prolonged. For example, you can see in neonatal wards, the physicians recommending that when the child is prematurely born, they recommend today. Earlier they used to not allow anyone to touch the premature born child, but today they recommend that the parents or significant others spend some time by taking out this child from the ICU unit or from the incubator, and then holding this infant in the arms, and also seeing that there is some amount of physical contact. And research has shown that this physical contact, babies with more physical contact had more survival rates compared with others. So, data has also been accumulating regarding the impact of other social factors, like the kind of friendship one has and the kind of other social systems, the support of other social systems like the family, like friends, and also the peer group, and also the colleague support. So, research has consistently shown that there is a positive relationship between social relationship and mortality rates. And in one very important study that is done in the recent years, 2010, by Smith and his associates, has given conclusive evidence in this regard. They did a meta-analytical study on nearly 148 studies. So, they had included in more than 3 lakh subjects. So, a meta-analytical study, as all of you know, it is these researchers, they try to collect data from all the studies that were done earlier, and they try to again statistically interpret the data and try to give the research findings. So, in their meta-analytical review study published in 2010, these researchers, they included 148 studies that were done so far in the area of social relationships and dying. And they had found that there is 50% more chance of survival in people who have strong social relationships. And they have also found that this research result is consistent across age, across gender, across the initial health status, and also the mode of death. So, it means that irrespective of the age group, anyone or across all the age groups, if they have better social relationships, their survival chance is higher. Similarly, both the genders, if they have high quality social relationships, their mortality rates come down. So, this study has given conclusive evidence regarding the impact that social relationships have on the process of dying. Their results found out that the influence of social relationships on the risk of death are comparable with those of either smoking or even alcoholism. It means that those people who are smoking and alcoholism, and those people with having lower social relationships, quality relationships, they have an equal chance at dying. This evidence is a strong point in the kind of the importance that we give to social relationships. So, in this module, we have not only seen the various dying trajectories and also the benefits of having a dying trajectory, and we have also seen the various theories regarding the stages in reactions to dying, and also the importance of social relationships.